Welcome back. Heart disease is the leading cause of death in both men and women, but heart disease has traditionally been thought of as a man's disease, even though across this country it continues to be women's most serious health threat. Joining us now is Dr. Chris Godlewski. Thanks so much for being here, doctor.
Thank you.
So how can heart disease present itself differently between men and women?
Well, there is a common perception that women present with a different set of symptoms of heart disease in comparison to men. And whereas there are some differences, to me, I think more important are the similarities. And what you mentioned in your introduction, the fact that heart disease remains the leading cause of health problem for women, both in terms of threat to their lives as well as the quality of life. We have to remember that it's a disease both of men and women, and generally the presentation is very similar. There are subtle differences which are mostly unexplained. The reason why it is that women present somewhat differently than men is not entirely clear.
Okay.
One of the differences perhaps is that women tend to present at an older age. Commonly, it is said that women generally are about 10 years older at the time when they present with heart problems. So older people, diabetics, people with high blood pressure tend to have somewhat atypical presentation. So what typically is described as a presentation of a heart attack or coronary disease is chest pain, central chest pain, which is crushing pressure and so forth. And women also present with those symptoms, but at times, you see, especially in older diabetic patients, atypical presentation, like for instance nausea, like for instance belching, vomiting, sense of profound weakness, sweating, and so forth. Okay. Sometimes even older patients, there is changes in mental status, like for instance confusion and so forth. So it becomes kind of nuanced to discern those symptoms because other diseases can present with similar problems. For instance, the epigastric pain right here in the pit of the stomach can be a sign of a heart attack, but it also can be a sign of gallbladder disease. So it requires attention, especially from the first contact physician, emergency doctors or even paramedics, to be aware of the fact that certain symptoms which are not classically described as, crushing chest pain, angina, and heart attack, that they also may be a sign of an ongoing heart disease.
Okay. Can you explain exactly what happens when a person has a heart attack? What's going on with your heart?
So the heart attack is a part of the spectrum of diseases called coronary heart disease, and heart attack and related problems fall under the category of a unstable coronary or acute coronary disease. The problem is the blood supply to heart muscle. So the heart requires oxygen and nutrients to perform the work. The heart works constantly. It's a muscle that works without stoppage, right? So it constantly needs to receive supply of energy and oxygen. So it has its own set of blood vessels that supply oxygen to it. So the blood that's inside the heart is getting pumped around the body, and the heart is unable to use this blood for its own needs, so it has its own set of blood vessels. When one of these blood vessels becomes clogged up by clot or by plaque, that's when you start having problems with the supply of blood flow into the heart muscle, and it can manifest itself as chest pain, angina, or if the blood supply stops completely, that creates a situation of a heart attack. And that in turn causes symptoms, which we talked about, either typical or atypical, and ultimately, if it's not remedied, can lead to permanent damage to the heart muscle.
And so you did talk about the symptoms earlier about a heart attack. Sometimes we hear this term silent heart attack. What is that?
So some people are diagnosed with an old heart attack without ever being aware of the problem. Some of those are truly silent, where people have just no symptoms whatsoever, and later on examination, they are found to have electrocardiographic changes or detectable damage to the heart muscle. Sometimes they have symptoms which they don't identify as a heart attack. So, for instance, somebody, has flu-like symptoms, or their shoulder hurts, or they have 2 or 3 days where just don't feel well, or have nausea, and they think they have a stomach problem. And then later on, it turns out that likely this was the moment when they had a heart attack, and they simply ignored it in the sense that they didn't recognize it as a heart problem. There's always something different.
So we're just about out of time before we need to take a break, but just really quickly, if those symptoms are more subtle than that chest pain that you talked about, does that mean it's less damaging or less dangerous than when you do have that chest pain?
Not at all. There is really no difference in terms of the danger to a person's health. And that's the difficulty in cardiology, the variety of symptoms, and the fact that sometimes those symptoms are not alarming to a person who perceives them.
Okay, and then just one final question, as far as if you are having a heart attack, or you're not sure if you're having a heart attack, what should you do?
You should call for help. There really should not be any hesitation, because there really is no time to waste, because the damage that can be done to the heart is irreversible. So you really don't have a second chance. You cannot wait a day or even hours to see how it turns out. If you are in doubt, you should call for help right away.
Okay, perfect. Thank you so much, Doctor. We do need to pause for a quick break here. But coming up next, what are the risk factors when it comes to heart disease, heart attack, and other heart failure? And are they different for men and women? We'll talk about that when we come back. Stay with us.